Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe what is dengue, its symptoms, severe dengue, and its treatment. Dengue virus are spread to the people through the bite of an infected Aedes species, Aegypti or A. albopictus mosquito. These mosquitoes also spread Zika, chikungunya, and other viruses. Symptoms: the most common symptoms of dengue is fever with any of following: nausea, vomiting, rashes, itches and pain, eye pain typically behind the eyes, muscle, joint or bone pain. Severe dengue: about 1 in 20 people who get sick with dengue will develop severe dengue. Severe dengue can result in shock, internal bleeding, and even death. If you have had dengue in past, you are most likely to develop severe dengue. Infant and pregnant women are at higher risk for developing severe dengue. Immediately go to a local clinic or emergency room if you or family member have any of symptoms. Treatment: no specific antiviral agent exists for dengue. Supportive care is advised. Patients should be advised to stay well hydrated and to avoid aspirin, acetylsalicylic acid, and aspirin containing drugs and other non-steroidal anti-inflammatory drugs such as ibuprofen because of their anticoagulant properties. Fever should be controlled with acetaminophen and tap sponge bath. Febrile patients should avoid mosquito bite to reduce risk of further transmission. Thank you for watching Daily Drug Info.